Hello everyone, this video is for the people considering breast implant surgery, and it's a consultation that we would provide to you if you were face-to-face with us. It also provides an opportunity for people who do have that face-to-face consult to revert back to this video for the information we have discussed in that consultation. We will be reading off a sheet, and this sheet goes through every point we discuss in the consultation. The first part of the sheet is that you're aware from having a nurse consultation that we provide you with general information, explain the process, and go through main risks, and it allows for you to formulate questions for the doctor consultation. In the doctor's consultation, it's really about your capacity to have the procedure, emphasizing the safety in the procedure, and going through specific risks. We always want to have a detailed history about your desire for treatment. We look at if you've had previous surgery, had weight loss over 10 kilos, if changes have happened with the children you've had, if your breast never developed. We also look at how it affects your self-esteem, feeling of femininity, if you're embarrassed about being naked, you're avoiding intimate relations or having problems with clothes you choose to wear. We want to know if it's taken a short period of time to consider this or a long period of time. We're looking at your desires for change. We want to know if you want a fullness at the top of your breast. We want to know if your nipples are in a position that you're adequate, if you need side breast, forward projection, if you have irregularities or you need reduction in size. We want to know if you want a look that's more fake, more natural, closer together, wider apart, or being very big. We then have an estimate of the breast size that you are, A through to E's and above, what you were at your maximum with childbirth or weight, and what you desire to go towards. We're always wanting to know if this is your reasoning, if no one's pressuring you, and if it has significant functional or psychological problems because of the shape of your body. Basically, we need the intent to understand that this is a purely cosmetic surgery. In your medical history, we're very interested if there's been any family history of breast cancer in mothers, aunts, grandmothers or sisters, if you smoke, if you have allergies, if you exercise, the pregnancies you've had, the medications you take, or your medical history or surgical history. We want to know bleeding disorders, your ability to scar, plus we need to know if you have any issues with consultations, admissions, or medication you take for psychological or psychiatric conditions. We will always be reminding you that people with psychiatric or psychological conditions will have a more difficult recovery and may have a reduced aesthetic outcome. In terms of the management, we're always going to go through that you have options to do nothing, seek psychological treatment, consider the medical options of fat transfer or the pill. We'll always discuss the position statements on cosmetic surgery about being elective and not affecting your general health. And we'll always tell you that you should have a consultation from more than one provider. We'll advise you that there are other ways to have the surgery, being in a general anaesthetic versus a sedation on a local model, a private hospital, a day hospital, or an ambulatory surgical model, being by a plastic surgeon or a non-specialist trained surgeon as myself. I'll explain my qualifications and training, and I'll give you an idea of my experience and the results that we've had. The surgical process is explained. We'll always discuss our policy on pregnancy, testing and your statements, pathology needed or medication before. Advice will always be to stop smoking. We'll explain why. The consent process is that you'll have to say you viewed the video, you understand the questions that we talked about relate to everything that you saw on the video. You've had a chance to ask questions in the consult, you've been given information packs to read, consents to read. My staff will have called you back and walk you through the consent, and you will initial every paragraph as you've understood and be signed by a witness before the date. And on the day you're even asked any additional questions. We feel that that process gives you very ample opportunity to understand it, and the process of having surgery is always with risks, and you must understand that. We'll decide about photography and discuss if you want them displayed, but we have to take them. And on the day of the procedure, you'll understand that you will be having an aesthetic change, and we'll be using a sedation model, and you will not necessarily feel nothing. You might feel pressure and pulling, but there's a difference between that and pain. We'll also tell you that most people will have a sedation and fall asleep, but we can't guarantee it's not a general anaesthetic. We'll discuss the incision placement, the pocket placement, and we'll work through the risks and logic of above and below the muscle. We'll discuss the risks and logic of a silicone versus saline, and the profile, that's the shape of the implant as well as the sizing. We'll discuss with you that the size and decision in the awake system is a benefit because you get an involvement. We'll discuss placement of the actual implant inside. We'll discuss incision closure, operative timing, and the options you have, i.e. using a Keller funnel to reduce the scarring, using the Dermabond to get rid of the issues of dressings later, and the special sutures that we use which have an option to reduce exposed knots. The recovery time after the surgery will be explained to you, and we'll work through the post-operative reviews at the next day, 2 day, 2 weeks and 6 weeks, as well as the post-op medication, wound care, and what you can expect for post-operative pain. We'll discuss wearing of the bandages, the support versus a surgical bra, the post-op actions in terms of rolling, massages and floor exercise. We'll go through the time off work and the variations between above and below, your mobility and return to light exercise, bouncing, heavy lifting, and how long to your final results. You'll always be explained the expectations of your breast being bigger, more rounded, more forward projection, and that most people will feel that you will be better. However, we'll go through the non-expected results in that your breast will be based on what you start with. They may not be perfect. You should expect variations. The implant will not lift your nipple, and your breast will not look like any pictures you have. And not everyone may like your breasts. Also too, you cannot get a cup size for any particular implant size, and you have a limit to your implant size because of what your body has. The implants will be heavier, the bigger implants will have more problems, and breast measurements between the various normal of 19 to 21 and 21 to 24 will relate to your desired outcome and need for lifts. We'll talk about the specific negatives, that it will take time to settle down. You may feel the implant. You will need to wear a bra to prevent sagging. You may have a difference in the healing between left to right. You could have problems. There is a chance between 18 to 18% of that you may need another breast surgery. In the future you may need either a reduction or a lift, and you will have requirements to buy clothes that may fit, and that may be difficult to find, and you may be subject to the looking and gazing of others at your breasts. We'll talk about the associated risks as we run through the process, and risks do break into the risks from the anaesthetic, from the surgery, an area-based injury, the specific risks to having the breast implants, and aesthetic risks. So you'll always be talked about the difference between a general and a sedation anaesthetic. We'll talk about the surgical risks of swelling, bleeding, bruising, hematomas, infection, wound breakdown, sensation, scarring, secretions, circulations, clotting, and the issues around that. We'll tell you the risks that we've experienced as well. There'll be risks of penetrating the lung cavity if you go below the muscle, or damage to the skin. They're all low, but you need to know them. We'll talk about temporary numbness around the nipples, not feeling around the stitch, edge of the implants, rippling, rupture, leakage, capsular contraction, and reaction to silicone. We'll also go through the cosmetic results of being too big or not big enough, subsequent surgery for marked future contractions, visible movements of the implant, displacement of the implant over time, the double fold and change of planes, and that the bigger the implant, the greater the risk of breakdown, muscles, symastia that's joining in the middle. We'll dispel rumours about implants not causing any adverse disease, that they do not change the incidence of cancer, that you can still have investigations for cancer, and the effects on breastfeeding. We'll talk to you about our complications and our dissatisfaction policies, and that if complications do occur, we'll treat you, give you emergency treatment, and a process of referral for second opinions will be initiated. If complications occur, you should expect extra costs, and there may be Medicare rebates, but they may not be possible. Implant leakage is covered by a lifetime warranty from the manufacturer, and if you remain at the same size, Medicare has an item number. Replacement of implants of different sizes will incur costs, and if you're unhappy about the cosmetic result, size, position, or shape, we can have a process in place for you for second opinion referrals. Now, if you're face-to-face, there will be a significant examination that looks at your body, the shape, the size, position, and from that we'll recommend the insertion site. Usually it's underneath the breast, but occasionally around the areola. We'll recommend going above or below the muscle, the type of implant versus a saline or a silicone, the profile, which is usually either a moderate or a high or a full projection, the range of sizes that are possible. We'll give you information to read later, discussion on our money-back satisfaction system. We'll encourage you to cool off and consult others, and give you a cost estimate. Now, there is always a waiting delay if you were under 18, and we will need the consent of your parents. and usually it will take you at least 7 days to get a booking, so that's time for you to consider your options. That's the consult in an abridged version, but all these points will be covered in your discussion, and I hope this helps you work out that we take your surgery very seriously and we want you to understand everything and get great results. I hope that helps you.